I am Lauren Block, and this is a Pathways to Resilience Learning Network session. For those of you who have not joined us before, Pathways to Resilience is a nationwide initiative to promote cross-sector strategies to prevent trauma and promote resilience and healing. We are very excited today to discuss ways that state and local officials, community leaders, and advocates are working together to prevent violence and to think about trauma responsive strategies to help survivors heal. And that's happening at the community level, the state level, and through advocacy. And these partnerships are really critical to help folks throughout the country. We are grateful today to have three fantastic speakers who are coming to talk to us about strategies that they have been using within their organizations and communities. I do want to note for folks that this session will be recorded and it will be available on the web afterwards. We will also prepare takeaways that should be available within the next few weeks also on the website. So I will briefly introduce our speakers, and then I will also ask them to share a little bit more about themselves. We have Abigail Hurst from Everytown for Gun Safety, who's going to discuss her recent research on the far-reaching impacts of gun violence on individuals, families, and communities. Welcome, Abigail. We have Andrew Woods from the Hartford Communities That Care, who's going to discuss hospital-based violence intervention programs and how Medicaid has been a policy lever to address violence in the state of Connecticut and the opportunities that could exist for others. And we have Nannette Dix from the Louisville Office for Safe and Healthy Neighborhoods. And she's going to share how her office provides community-based programming and trauma-informed services and referrals to build more resilient communities. And I'm sorry, I said Louisville. Louisville is a community here. Louisville is what I meant in Kentucky. I'm in Colorado, so sorry about that. So I also, for those of you who have not been on these before, these are intended to be interactive sessions. We do encourage you to stay on mute while our speakers are speaking, but please feel free to raise your hand and use the chat, ask questions. We'll be also sharing resources today as we go. So please definitely participate in the session with us. So, and this really is, again, a discussion format. So I'd like to start with Abigail. Could you briefly introduce yourself and give us a little bit of an overview of your research findings from your report that you released, and we'll share the link to it, Beyond Measures, Gun Violence Trauma.
Yes, of course. Thank you so much, Lauren, and to the whole Pathways to Resilience team for hosting this series. I'm so excited to be here with Andrew and Nannette for today's discussion. So a little bit about me. I'm a proud social worker, and most of my career I've actually worked with survivors of different forms of trauma, including survivors of intimate partner violence, sexual assault. And for the last almost 7 years now, I've been working with survivors of gun violence through the Everytown Survivor Network. And we are a national program that offers trauma-informed programming for survivors of gun violence to connect with other survivors through peer support, as well as programs that are created really for a platform for survivors to take action to end gun violence through legislative change and to raise awareness if they choose to. So over the years, as I've worked with survivors of gun violence, I've seen the power of survivors to create incredible systemic change. At the same time that I've also witnessed the grief and the trauma and the pain of gun violence. So Everytown for Gun Safety, we recently conducted a qualitative study to better understand what the short-term and the long-term impact of trauma from gun violence really is, and ways that we can better support survivors of gun violence. So what we found was that the ripple effects and the reverberations of trauma from gun violence are profound, and they're beyond measure in so many ways. And that's actually why we titled the report Beyond Measure. We know gun violence is a collective trauma in our country. We know that it impacts generations. So especially as children bear witness to gun violence through the media, through social media, as they are experiencing the threat of gun violence in their neighborhoods, in their schools. And as those children grow, they are ultimately being shaped by gun violence. We also learned from our study, and something I've seen many times over the years, is that the trauma from gun violence can reverberate across geography and beyond neighborhoods. So it can affect the behaviors and the actions of a person who has a shared identity with an incident of gun violence. And this was especially relevant in incidents of hate-based violence. So if we think about yesterday being marking the 7 years since the tragedy of the Pulse nightclub shooting in Orlando, Florida, our findings show that LGBTQ+ people across the country and beyond the community of Orlando, Florida, their behaviors and their actions were affected by witnessing that horrific act of gun violence because of the shared identity that they had with the community that's targeted. So we see over and over again that people aren't only deeply saddened by the horrific act of gun violence that so many of us bear witness to, but their behaviors and their actions are changed as well. So this study showed us that in 1 in 3 survivors of gun violence, they live in fear and they feel unsafe, as exposure to gun violence erodes a survivor's sense of safety and ultimately how they navigate their environments. Nearly 1 in 3 focus group participants indicated that mental health counseling was their largest unmet need. And honestly, I could talk on and on about the findings of this study. Thank you for linking it in the chat. But I do just want to thank Pathways to Resilience for being a great partner in the analysis of the focus groups. You've all been such a joy to work with. So thank you for all your work too.
Thanks, Abigail. This is really a pleasure to get to help work with you on this report. I don't think any of the findings are surprising, but I do think you really added some really good analysis for folks to be able to understand the implications and the sort of the ripple effect and how far the implications can extend beyond the individuals who are directly physically present during an incident. Andrew, I'm going to turn it to you now. Could you introduce yourself a little bit? Tell us about your organization and just briefly discuss a little bit about what led you to consider Medicaid as a means to support your hospital-based violence intervention program.
Sure, Lauren, and thanks again for the invite as well. I'm the executive director of HCTC, Hartford Communities That Care. We actually started 25 years ago. In fact, this coming Thursday, we'll be celebrating at our gala and honoring the 25 years that we've been doing this work. But really what has happened is that for an agency, we really started out doing mentoring, youth leadership development work that also 25 years or so ago, we began to see an uptick in youth violence among teenagers primarily. But pretty much since the inception of HCTC, we've done mentoring programs, leadership development, after-school programs. And then back in 2002, 2004, we started merging into hospital-linked violence intervention program work. And that's when we began to partner with one of our local hospitals to primarily respond to and support victims of gun violence. What we determined over the last several years, or at least in the last decade or so, is that, quite frankly, many young people who were violently injured, we had high rates of recidivism. We also seen a number of individuals who were basically, when it came down to supporting them for their care, wraparound service supports, et cetera, those are the things that HBIPs provide, which is not only the response, but also the aftercare supports, mental health supports, connections to medical and other provider services. But what we determined was that very little funding was available for this work. And so we would pretty much cobble together the resources. As an agency, it was a priority for us to continue to do this work, but absent a lot of the resources and funding. And so when it came down to really taking a look at how can we get the resources to support HVIP work and our other mentoring and prevention services related to addressing violence prevention, we decided to take a look at the data. And that's something that we've always done. And what does the data tell us about who is actually paying for the cost? In other words, we wanted to present a business case for getting folks to pay attention to urban gun violence. And so we took a look at the data. Who was paying for it? Was it commercial insurance? Was it Medicaid? Who was actually paying for these costs? And then we would look at pursuing those individuals and saying, hey, look, you got a stake as well. And so we did a return on investment analysis on gun violence and also what it cost. And also based on our interventions, what we could potentially save the state of Connecticut and consequently taxpayers. And so that was the business case that we presented. What we discovered was this: in Hartford, Connecticut, and in many other urban areas, urban gunshot victims are not commercially insured. It's primarily Medicaid that covers that cost. And so what we decided to do based on that, again, was to present a business case for that, to say to the governor, to the legislature, and to others that, listen, very little resources are invested in this area, but there's a lot going out on the back end in terms of care. Why don't we look at stretching or spreading those dollars across from a prevention and case management support services, let Medicaid pay for some of those services. And that's how we begin to build the case for Medicaid to support this work.
Thanks so much, Andrew. And we'll be talking a little bit more about this. We always like to take examples of what's working in a state and figure out, is this replicable? What could others do? And stay tuned because Andrew is going to be sharing some lessons learned with us shortly. But now I'd like to turn it to Nannette. We'd love to hear a little bit more about your work in Louisville. I'm going to pronounce it correctly this time, and also talk a little bit about your office and some of the work you've been doing through grant funding.
Okay, so I work for the Office for Safe and Healthy Neighborhoods, and our office has been pushed to be the backbone behind the city's trauma response. So we recently just had 2 mass shootings, one that was very publicized at Old National Bank. And then we had one in one of our parks here that is predominantly, a lot of families, African-American families go to that park, and on one, day when it was a good weather day and everybody was at the park, 2 people got killed and others got shot. So I know Abigail talked about how trauma hits you, vicariously, like at the Pulse nightclub. We have to think about that also for everybody, and look at it widespread. For us as African Americans, we had a shooting here a few years back where a gunman went into one of our Krogers and shot 2 people dead. So when we heard about what happened to Buffalo, it had a great impact on us. It made people scared to go into the stores. It made me scared. I had to start looking at which ways do I leave, and if I take my grandkids to the store with me. That's how impactful it is. And trauma impacts you. Trauma can make you go into a cage in your mind, and it can make you very hypervigilant. You're going to get me, I'm getting you before you get me. So we look at the root causes of trauma, what's going behind. We look at, also, ACEs, adverse childhood experiences, because a lot of these kids, and Andrew said it, a lot of these kids, it was a lot of youth, and all these kids are going through a lot of stuff. And we don't come into this world with this magical, theorists were telling you everything, or dictionary or encyclopedia telling you all the stuff, like turn to this page and it'll tell you how to deal with trauma. Turn to this page and it'll tell you how to deal with gun violence. We're learning this as we move and matriculate through this life. So what we do is we work with communities and community partners to see what they do well. And we pair with people that are already doing the grassroots work out there and say, hey, if we come alongside you and use and place mental health with it, because we know that, say the spot is a young adult opportunity campus. What they were seeing is they had a lot of kids that went out and they, they'll get them jobs and stuff, but then they were losing their jobs and they were like, well, why is it happening? I said, can we do an ACEs assessment? Let's see how many people score 4 more in their ACEs, because ACEs could be a predictor to, outcomes, maladaptive outcomes. A lot of those kids had a lot of ACEs scores, over 4. So we said if a kid has a youth has a score 4 or more, then we're going to, gently ask them, do they want to do individual therapy or group therapy? So we had a combination of both, and both works wonderful. Group therapy works a lot better because sometimes we think we're the only person, or we think we're crazy and we don't want to talk about it. But then when you hear somebody else in group say it, you're like, oh, okay, this is what, this is normal to feel this way. You don't think you're the only one out there by yourself. So what we see at first, they was like, no, I don't want to go talk to nobody. Now they're asking to sign up. So with that intervention, and it's changing, and a lot of people are holding those jobs down and stuff like that. So we look at just, trauma through the lens of different lenses. And we, like I said before, we really go in and we try to make every program that we do is specific for that population that we're serving.
Thanks, Nannette. And tell us a little bit about what makes this possible. What are the vehicles you're using, funding or grants or otherwise?
Well, we have been very fortunate. We're a Louisville Metro government, so we have funding sources. So we have the grant that we started that created this wonderful program, this TRC program, Trauma Resilient Communities program, was a 5-year grant from SAMHSA. We're on our 5th year. And we have been asked to also, because we know we're going to have some funding left over, to do a no-cost extension, which we will be doing. And what we were going to be doing with that is more training, especially to paraprofessionals. Some of those folks that are out there doing this work, we're making sure that they get well trained in trauma-informed responses to be able to better serve the community, and also making sure that they have wraparound services for themselves, because it's difficult, the work that we do. And then we just been blessed with a new recast grant, recast 2.0. So we are going to be doing that, working on that. Our grant will start the end of September. So they always start at the end of September. We'll really, actually October 1st, we'll be up and rolling. And so we're really going to be pushing that grant into the Latinx community and the immigrant population, which has had a rise in violence in those two populations. And then we also have some ARP money, some ARP, American Rescue funding, which has been very beneficial for us to be able to meet some of the gaps in the systems. So when we did some of our programming, and we do a lot of research on our programming, so we have an evaluation team that evaluates all of our programming. What we found and what the feedback was is, why do we have to come out of our communities to get this service, especially in the Black and Brown communities of West and South End of Louisville? Why do we need to come out of our communities? So that ARP money allowed us to put in place programming directly into communities. So what we did was partner up with another agency, which is the Neighborhood Place Agency. And the reason why we're doing that is because the neighborhood places are all throughout the targeted areas that we're seeing the most violent crimes. And so we can put them right there, and people can come right out and they can go and have walk-in services. So we're going to have a person in there that is really versed in, doing those services. And if they need an individual therapist, the individual therapist can come straight to their house, because we work with a lot of victims of gun violence, and some of them don't want to come outside. We working with one woman now who was, in the bank when the gunman was there. So she's, our intentions are to coach her and, have her baby steps to come outside, because we don't want her to be locked up inside her house and creating phobia. So our intentions of her being able to be safely coming out. And she, she came to us. She said, I don't want to live like this. I'm scared, but she's processing through what she saw. So what we're doing, we're meeting you where you are, and we're listening to your voices. So we don't think we just collect that information and just store it somewhere. No, we take that information as, the folks on here can tell you, we take this information and we do something with it. So, and that's some of how we got some of our programming, because of the information that came back from all of our evaluation.
Thanks, Nannette. And that's really helpful. You definitely are taking a comprehensive approach, looking at individuals, giving opportunities for groups, meeting people where they are, also helping to address the workforce, recognizing the stress that that doing this kind of work can involve for the workforce. I think this goes nicely into my next question for you, Abigail. You have the idea of post-traumatic growth as part of your report. And I know many of the people on the call are familiar with trauma-informed or trauma-responsive practices, but may not be quite as familiar with this term. So I was wondering if you could talk a little bit about what is post-traumatic growth, and how does it relate to being trauma responsive? And how can we think about this also? How can policymakers and community leaders really think about this concept?
Yeah, I feel like throughout my career, I've actually received a masterclass from survivors on what post-traumatic growth can look like. And it's really this concept that some individuals experience a positive growth of some kind following their struggles with trauma. So this type of growth, it can be measured by new possibilities for one's life. It can be measured by improved relationships, a greater sense of personal strength, spiritual development, and even a greater appreciation for life. We saw in our focus group findings that nearly half of the participants spoke to experiencing post-traumatic growth of some kind. But I think it's also important to note that some people rejected the concept entirely. You know, post-traumatic growth was not a concept that resonated with them. It is not something that they saw in their lives after experiencing tragedy or trauma. And what we saw is that in addition to a person's innate resilience, trauma-informed and culturally responsive programs are so critical to support people after trauma. So access to mental health services was key for survivors, as I mentioned before, in order to process their trauma and embark on that journey towards healing and potentially post-traumatic growth. In particular, access to those culturally responsive or culturally specific resources and programs, like the incredible work that Nannette and her team are doing. I love so much of what you said, Nannette, because it really speaks to meeting the needs of the community where they are. And that is such an important opportunity for survivors of gun violence to heal and embark on their own journey towards healing. But specifically relevant to culturally responsive programs, we really must do better to ensure that people are not being further harmed by racism, by homophobia, by stigma, by bias, by ignorance and intolerance as they are seeking help. So finally, access to peer support programs, similar to the group programs that Nannette was also speaking to. It's a profound way for survivors to connect with others who have walked a similar journey of grief and trauma, and potentially even walked a similar journey of post-traumatic growth, and not be alone as they're navigating those ebbs and flows of the trauma response. So for folks on this call today, doing all that we can to make sure that we are doing our own work to be culturally responsive, to be trauma responsive, and investing in mental health resources is so important, so we can foster those environments for people to heal and grow towards healing.
Thanks, Abigail. And I know it's a complicated notion of thinking about a positive thing that can come out of something that's so awful. But I think it is certainly part of the healing journey and important to think about, and to have those supports in place to help people along their healing journey. Andrew, I'd like to turn it back to you. You talked a little bit about the ROI, or return on investment, work that you did to make the case for the legislation that was passed in Connecticut, and we'll be posting the legislation in just a moment. But could you also talk a little bit about how partnerships and coalition building played a role in this? Like what kind of supports did you need to make this happen?
Yeah, absolutely. Part of our background is as an agency is that we've always been engaged in not only public policy work, but also coalition work. And so when it came down to taking a look at the data first on what it said in terms of who's being injured, what the cost is, who's paying for this, such as, again, the state of Connecticut and taxpayers. Then it was really around us bringing this to the fore by inviting stakeholders. So in December 2019, we convened a group of stakeholders here at our offices, which include Fatima Muhammad, she came up from the hobby. We had folks from Giffords who are also involved. We brought folks from the state capitol, our federal and state and local lawmakers together. We brought the hospitals together, including the Connecticut Hospital Association. We brought together victim service organizations and victims and folks who are actually out in the community that are being impacted by violence in our community. And really what we wanted to do on day one, or at least for that first convening, was to educate folks specifically on hospital violence intervention programs, how they work, and the impact they have in terms of saving lives, reducing violence, et cetera, and so forth. But also what we wanted to do was talk to the public and share with the public on the opportunities here to really leverage multiple streams of funding. So give you an example, we talked with folks about the VOCA funding that was out there. We happen to be a recipient of one of the first vocal grants in the state of Connecticut to specifically target boys and men of color who were the primary victims of violence in our community. But also we wanted to educate them on Medicaid and the fact that this is not resources that are currently being used, but could be used. And then once we pulled together folks and really educated them on these issues and really what some of the low-hanging fruit is and also what some of the work looked like moving forward, we also back channel work with some of our key lawmakers at the state level to say, hey, listen, once this convening is over with, which was in December, come January, we really need you to put a bill in, a Medicaid bill, to basically support violence, victims of violent crime and their families. And that's exactly what happened. So January of 2020, a bill was introduced by our Speaker of the House, as well as other key leaders within the state legislature. Representative Jillian Gilchrist was running point on this for the Speaker and in collaboration with the Speaker, as well as she also facilitated and coordinated meetings with other key lawmakers within the state legislature, as we on the coalition side continue to mobilize our partners, our other stakeholders, to where we all were in lockstep on exactly what we needed to do to, one, educate other lawmakers, go to committee meetings, as well as door knock or put phone calls through, and again, contact people that we needed to be in support of this. But one of the things we also were very, very keen on was that we also wanted to stay on message. And what I mean by that is this: we wanted this to be a successful endeavor legislatively. And that meant that we didn't want to run the risk of this bill not making it to the finish line. So that meant making sure that our message was not about taking guns out of people's hands, or it was really about public safety. It was about public health. It was about what Medicaid can do to support victims of violent crime, and then make sure that we did not allow ourselves to get distracted by someone that may think it's about something else. And so as a result of that strategy, we end up getting 100% bipartisan support for this bill. In one session, we got it all the way to the finish line, and the governor signed a bill here at our offices in the north end of Hartford, which is a primarily African-American community. And so really, it was those 4 points, if you will: convening stakeholders, getting the lawmakers to introduce a bill, continue to mobilize our partners, stakeholders, and then stay it on message. And that was really, in essence, how we were able to get Medicaid across the finish line.
Thanks, Andrew. That's really helpful. And I want to remind folks who are joining us today, you all, I'm sure, are experts in your own right. And if you have questions or comments for our speakers, please do use the chat. We would love to hear from you or hear about any successful measures that you have taken in your own home states and communities. Nannette, I wanted to ask you a little bit about your experience working with cross-sector partners and how you have incorporated community voice in the implementation of the grant activities that you've been pursuing.
So before I've been in this position, it's been a little bit over a year, but before I got here, I was the administrator of a neighborhood place. So I was very immersed in community, especially the Park Hill community, which is the most violent community here in Jefferson County, and I think in the state of Kentucky. And so I purposely always put myself out there in the community among the people that we're working with, and made sure that I was a part of that community, meaning that if they had something, I showed up. And once you show up, because you have to have that, you know, as a social worker myself, like Abigail said, you know, at heart, you know, the first rule of thumb is that engagement. So you have to have people, you have to engage in people, you have to let people trust you. And once they start trusting you, they open up to you. So a lot of times when I'm working with people in cross sectors and stuff, it's because I already know the background of what the community say they want and what they need. And then what I do is go out there and look for people that are already doing that great job, and how can we add value to what they do. So that's what we're doing, just looking at people that are already doing that great work out there and how can we add value. So when we do that, it's by just people talking about other people like, hey, you know, so-and-so is doing this great work right here. And I think they'll be a great asset, or you maybe a great connection. And then we go and talk and we make sure. So we listen to the voices of the folks because, you know, it's in the African-American community, and that's all I could talk about really, is because I know the African-American community. I'm a part of the African-American community. So, but I'm not the voice for everybody in the African-American community, but I know that trust means a lot. We have to trust what you say. Before we come, we're going to, you know, we'll stick our toe in the water a little bit, but we're going to have to make sure that water is the right temperature for us. You know, don't be trying to burn us and say it's, you know, warm and cozy and we get in there and we get 3rd-degree burn. We don't want to do that. And it's a lot of mistrust. So we work for Louisville Metro government. So Louisville Metro government, you know, are they in your business? Are they trying to, you know, are they trying to give me the therapy to be in my business or whatever? So we know that we need to have people that they already trust. And hey, how can we work alongside you to make sure that they get in some of these good programs? Like we're getting ready to have a program that's going to be in the parks is starting next week, by the way. It's called our Mind, Body, and Soul program. So we're working with youth within our community centers, especially youth of color, because we know that they don't have a lot of opportunity for different things for the community. So it's sort of like, it's therapeutic in nature, but it's like giving your kids vegetables in a fruity form. It's going to be so much fun. They don't know that they're getting good stuff. So the mind piece is going to be all visual art, getting your stuff out there. And the body piece is all about movement, whatever, but it's going to be child-led. So we're going to have local artists that are going to be stationed at each of these programs, these spots, but they're going to be working with the kids and seeing what they want. Like they have a rubric of like, okay, this is what we're doing. And that's what I always say, we're trying to do like this. We create the frame of the house at Louisville Metro government. And that's how we work with Cross-Sector. We create that frame because we know that there's only certain guidelines and stuff like that to grant funding and stuff. We understand you have this guideline. So we create the frame. What we do with community is you come inside and you pick out the color cabinets you want. You pick out the flooring. You pick out all those things that make that house a home. So that's what we do. So what we do is try to listen to your voice and see what you want within that framework. So we're building this house, but you have to make this house a home. So that's what we do.
And that's, I think, really helpful metaphor as we think about, you know, there are so many parameters around federal grant funding, and but it's also really important to be able to hear the voice of the community and customize things to suit needs. And so I think that is a lovely kind of framing to think about how you're building the infrastructure and people can design as it works, but while still working in a compliant manner with the federal or local state guidelines. So thank you.
And you have to do that. You have to have that, because it's not fair for us to say, okay, come on and design and come on and do what you got to do, and then we don't have that framework, because then, you know, a lot of people, especially if they're dealing with a lot of trauma, they think from here, you know, think from the heart. But we have to think from here most of the time as, you know, people that are working with the federal dollars, because we know, hey, we can't cross that fence. So why would you open this ground up and you know that they have a magnetic fence around them, and they were like, oh, I want to go over there, and then they get zapped? Then you re-traumatize people. So if you come to the table and say, look, this is the framework, you create this into a home, make it within this perimeter, make it yours. And that makes it's a win-win situation for everybody.
And I'm going to use this as a quick opportunity. I don't know if my colleague can find the link, if we still have it, if we have it online from our May event recording, but we did do an event about trauma responsive spaces and how different types of spaces can be designed, thinking about engaging with people with trauma, whether that's visitation rooms for kids involved in child welfare or for justice involved populations, or other spaces to housing for individuals who are formerly homeless. So thinking about all these ways that we can do more to create healing centered spaces. So your metaphor there really speaks to the event we did last month. So if we can maybe pop the link in there for folks who weren't able to join. I did though I wanted to circle back to, so we've now talked about who needs to be at the table, who the key players are. And Andrew, you talked a bit about how you didn't make this about taking guns away from people. You really made it about public safety. And so, Abigail, I want to hear a little bit more from you about how you've been able to elevate the voices of those affected by gun violence, and also really find common ground on that sensitive topic with a wide range of people about what this all means, to what it is that we're trying to do, so that the messaging resonates with everyone.
So I believe that it's important to elevate the voices of survivors, because survivors are powerful. It's strategic. It's the right thing to do. And I've sat in rooms with elected officials and survivors of gun violence as survivors shared their grief and their outrage on how the system has failed them and the ways that gun safety laws must be strengthened to save lives. And I have seen those survivors change hearts and minds to result in that legislator taking the vote to pass that law, or becoming the champion that we need to pass that legislation. So I believe in the power of survivors because I've seen it countless times throughout my career. And frankly, with 59% of Americans being personally affected by gun violence, we're caring for someone who has been personally affected by gun violence. The odds are that when a survivor speaks, there is someone in that audience, or there is someone in that room that may have had their own lived experience with gun violence. So whether it is the loved one who died by suicide with a gun that no one talks about anymore due to the stigma around suicide and grief, or people like me, as my Aunt Sue was shot and killed by my uncle in a domestic violence murder suicide. And this was a few years after I actually started as a staff member in the gun violence prevention movement. It's likely that there are people on today's session who have their own lived experience with gun violence. And so I just have to say, if that is you, I acknowledge you and your lived experience and the power that you hold as a survivor and as someone with lived experience. Mm-hmm. We know that survivors of gun violence are breaking the silence through their storytelling and speaking their truth to power. And as someone who's been working on this issue specifically with gun violence prevention for many years now, I've had many conversations about gun safety and gun violence prevention with people who at the beginning of that conversation, I may have thought would have been on the opposite side of the issue than I was. But I've learned how essential it is to hone in on shared values in having these conversations. So shared values like Andrew was speaking about, with public safety or safety as a whole, love of community, which we were hearing Nannette speak to so often in her remarks, love of family. When having these conversations, it's so important to come back to these shared values, speak to them, but also listen for those shared values when the person that you're engaging with is speaking. So if there are ways that we can come back to those shared values and having sometimes very heated or charged discussions, I think that's an important bridge that can result in progress. Because we all know that we want our loved ones to be safe. We all want our children to grow up and fulfill their bright futures. So that is an important common ground, I think, to fight for. And time again, I've seen that there is common ground to be found on gun safety and gun violence prevention, because I know what's at stake in our country when we're thinking about gun violence prevention. And because I know it is at stake, I'm always willing to have those tough conversations and listen and try and find that common ground to save lives.
Thanks, Abigail, for sharing that perspective that I think is useful for everyone, but also that kind of very personal story. Does anyone, I want to provide a moment if anyone wants to, whether participants in the webinar today, if anyone wants to come off mute or write in the chat and share kind of any messaging or strategies that have worked in your communities to kind of build that buy-in and understanding of the impact of trauma, the trauma and the opportunities for resilience. And Andrew and Nannette, if there's anything on this point that you want to add before we move on to our next question. Okay, all righty. If folks are interested in speaking, please feel free to use the chat. I do see there is a question coming in for you, Nannette, about whether or not there are organizations in Jefferson County that help families purchase a headstone due to losing a child to gun violence. That's a pretty specific question, so you may not have that answer right now, but just in case, I don't know if you have any reflections there.
Well, I know that we have our multidisciplinary team that we work that is under the umbrella of the division of TRC, which I run. And we do have some funding for folks for burial costs and different things like that. But I think it's specific, guidelines to that. But if they would like to reach out to me and I'll learn more, because I think it has to be in a certain time frame and all that stuff. But we do work with, our MDT team works only with victims of homicide. So we work with those families. So just get with me. I'll put my email in the chat, and then you can reach out to me and we'll see. We'll make sure.
Thank you.
Try to find you somebody.
Thank you. And I see folks are sharing. We have First Lady of Delaware, Tracy Quilling-Carney commenting here, and then Melanie Snyder also sharing a messaging tool. So thank you everyone for your contributions here. Keep the chat going. Andrew, I'd like to turn to you with another question. Can you talk a little bit more about sort of the evolution of your work and how considerations around sustainability have factored into decisions for programming and your relationship building and funding? I know you've already shared a lot, but if you have anything else you want to share on that front.
Yeah, certainly. Like many of our folks on the line here, I'm also a trained social worker. And one of the things early on in my career is that I really started mentoring young people to really take a look at how they viewed the issues. And so what that really, what we took into account was how they processed information, how they saw their own community, how they viewed their interrelations with their own peers and with their families and with the general public, but also how violence at that time and even drug use was impacting them and their peers. And so as a social worker, I wanted to take a look at that information by conducting focus groups and key informant interviews with young people and the teachers and other stakeholders who are in their lives, and to really come up with what was some of the programmatic funding and policy recommendations young people believe can help prevent and drug use among their own peers, as well as intervene, et cetera. And again, elevate that data, that information, not just anecdotally, but also what did the data say. And that's how I actually started doing this work, is getting input from young people. And so that was our Youth Leadership Academy 25 years ago. It was a cohort of just a classroom of students that the school gave me to work with. And I volunteered there for the first 5 years, 20 hours a week, teaching young people how to do public policy work. And these were 7th and 8th graders in the urban community, primarily African-American and Caribbean youth. And so those kids end up going over 22 different states, in and out of Congress, the State House, local City Hall, presenting their findings. That morphed into our agency. That morphed into us securing resources to actually do more sustainable programming. And then again, when we got involved with hospital violence intervention work, those same practices of soliciting input from our constituents was what we used as the foundation to build the case. And so for 25 years now, that's exactly what our formula has been. And it continues to be that way. That Leadership Academy that started 25 years ago still to this day presently exists. And I put our website in the chat there of Hartford, www.hartfordctc.org. And you can actually go on our website and you'll see a lot of the work that our young people do. Even during COVID times, when the country was in lockdown, instead of meeting virtually, they started meeting virtually and hosting. And you'll see a lot of that stuff on the website in terms of how they engage themselves, the peers, et cetera. And so as a result of that, to this day, again, I talked about VOCA funding. We were able to build the case for that federal earmarks. We've been the recipients of the last 2 rounds of federal earmarks. And then we're pursuing a 3rd one as we speak. Foundation funding, ARPA funding, as Nannette spoke about. And then, of course, we're able to get the Medicaid across the finish line And now we're looking at ways to creatively tap into those resources as well. And so, but again, it really starts for us. It will always be that you have to engage your constituents. You have to engage the people who are directly impacted, and then get a sense from them, not just a sense, but get a solid confirmation from them on exactly how they view the issues and what they believe the solutions can be. And then you get that before policymakers and other stakeholders who can help support the programs and services and the policies that emanate out of the community.
Thank you, Andrew. Thanks for sharing, Sarah, the website for Hartford Communities That Care website. Abigail, we have another question for you that came from the audience and registration. We have someone asking, how can we create policies that have a de-escalating effect?
So oftentimes de-escalating, it's been relevant in classrooms or service providers or violence interruption work, and people are being taught ways to tend to the trauma in other people. So how is trauma manifesting? How are people being activated? But what is consistently lacking in training and programs and resources that inform those policies and those programs is de-escalating the staff who are oftentimes navigating their own trauma responses, whether it be through direct trauma of their own lived experience or within the community where violence is happening, or secondary or vicarious trauma. So my advice or my response to this question is really to start with tending to the trauma of your own people, tending to the trauma of your staff, tending to the trauma of yourself. It isn't only the right thing to do, but it's strategic because it results in sustainability. It results in showing the folks who are working so hard to tend to the needs of others that you care about them and that their well-being matters. One organization that I know is doing incredibly important work that kind of models this is the Roca Impact Institute. They have a couple different locations, and I know we'll put the link to their organization in the chat, but they're doing incredible work to train community violence interruption professionals on trauma and the brain. So ways to acknowledge and tend to the trauma in their own bodies, as violence interruption workers are really on the front lines, witnessing incidents of gun violence, sometimes being in situations where they are in harm's way, but tending to their own trauma so that they can de-escalate themselves. But also then how can they build relationships, build trust, be consistent in tending to the trauma of youth who are at high risk of violence in the community. So check them out. They're really doing incredible work to disrupt cycles of violence and prevent future trauma through better understanding trauma in the brain.
Thanks so much, Abigail. I'd like to ask the question that we ask in every session, even though we cover lots of different topics. And this is where I'd like to ask each of you to focus in on one or two really actionable steps that state or local government policy makers and program folks can take when it comes to implement violence prevention strategies and trauma responsive practices to help those who have been impacted either directly, vicariously, or otherwise. And I know you've all shared a tremendous amount already, so this might be something you're repeating that you think is worth additional mention, or it could be something you haven't shared yet. So Nannette, let's start with you. What are your one or two actionable steps that you would advise others take?
I'm just going to piggyback on Andrew with this. It's just, we need to have youth voices, because so many times we create policies without even having a youth voice, or, like we know everything about everything. And so I think we need to utilize youth voices, because youth are a lot of times, I'm just speaking for Louisville, are the perpetrators of the crime, and also they're the victims to and fro. So we have to have youth voices and making sure that we utilize their voices, and also just be honest with ourselves and understand, like I think Abigail was talking about, understand your own trauma map, because I think sometimes we make decisions based on how we feel. and where we are in life. And so those are my two takeaways.
And I think for me, I'm going to, maybe elaborate on what Abigail has touched on, because it's an area of increasing concern for me for people who do this work. So for those of you who represent municipalities and government, and those that support these programs or fund them or implement them, that at the end of the day, there are individuals out there that are doing this work. They're frontline service providers that are chronically exposing themselves to circumstances that becomes increasingly difficult for them to manage the stressors themselves. And oftentimes we really don't take that into account. So I'll give you an example. When I started doing HVIP work, it was just myself and one other person, literally for at least a decade of doing this work. Now, we were able to bring in a few individuals, again, because folks were not investing in this work. And quite frankly, we're just beginning to see dollars come into supporting violence prevention and intervention work across the nation, thankfully. But that's only been in the last couple of years, and more increasingly in the last several months, and hopefully, for the foreseeable future. But across the country, folks that do this work literally only have 1 to 2 staff people, 3 to 4 sometimes. And that's the average number of staffing across the country with many of these programs. Now, I'm not saying you don't have programs that have 10 and 15 staffers. We have, 15, 20 at this juncture because we have a variety of different funding streams coming in. But I can tell you this, one of the things I've learned is that we cannot keep exposing or allowing frontline workers or anyone that does this work to keep running hard. They need breaks just like you need a break. They need to have vacations just like they need to have a wage that supports them and their families. They need to be able to take time off and then be encouraged to take time off, because there's just simply no way to keep doing this work without having a significant impact on the people who provide this service. And as an extension, the impact that's going to have on those that they call that they're trying to help. And so if there's anything that government or you folks on this line, on this call, I really encourage you to really get that some serious thought. Make the investments, make sure that those that are providing this service is getting the supports that they need, and stop burning people out, or at least stop aiding to the burnout in ways that has become somewhat, well, quite frankly, reckless to the people who provide this service.
Thank you so much, Andrew. Abigail, I'm going to turn it to you now for your takeaways.
Yeah, so I have 2 takeaways. The first one is for folks to do the hard work of exploring your own biases and your own privilege so that you're not doing further harm as you are supporting people who are seeking help. I think it's so important to educate ourselves on cultural humility and culturally responsive programs, and learn from culturally specific organizations out there that are doing incredible work. So really do your own learning, do your own exploration. And then the second takeaway is really building off of what Andrew and Nannette already so profoundly shared, which is it might sound counterintuitive, but please rest in some way. The work that we do, it takes such a hard toll on our bodies, on our minds, on our relationships. And so if there's a way for you to find rest, whether or not that's mindfulness or meditation, is connecting your mind and your body, or maybe that's actually taking a nap and resting your body. Maybe it's scheduling that vacation that you've been thinking about for a while. Maybe it's scheduling an afternoon to just stay put and quiet or tend to things that you need to tend to that you've been putting off. I think it's so important, especially on an issue that oftentimes feels like marathon and a sprint at the same time, to find ways to rest and care for our own selves. So that would be my second takeaway.
Thanks so much, Abigail. And I will use this moment and opportunity, because we're doing so much talking about the workforce, to recommend that for those of you who haven't seen it, in April, we did a session about creating trauma responsive workplaces. And we had fantastic speakers with, I believe, 3 or 4 different speakers for that event. So Sarah's going to post the link right now in the chat so that you all can find that as well. And also we are offering trainings through Aurora Health Group Pathways about becoming a more trauma responsive workplace. It's very much focused right now. We're looking a lot at state and local government, but open to others, and we can customize that training based on your workforce and help do an assessment. So please feel free to reach out if you've got any questions about that. But before we leave today, I do want to do two things. One, I want to thank our amazing speakers. So many useful tidbits and pieces of feedback and insights about what we can be doing in community, state, and federal level to think about how we can do more to be to prevent that, to think about prevention. And to also really think about trauma responsiveness for people who have been impacted by gun violence, either immediately or those who were affected either vicariously or as larger parts of community. And really important to recognize that the impact does spread far, and that there's so much that we need to do, more that we need to do to not only prevent, but also to be more responsive and ensure that folks are getting the services and supports that they need. In addition, I would like to make sure that folks are aware of our next session. Our next session is going to be on July 19th. It will draw a lot on some of the themes we heard today about how to engage community. It's a session about building trauma responsive networks of care. And so we will be having speakers from California and from Ohio talking about their work to look across sectors to really bring together community to recognize and support folks who have experienced trauma, and to really be there as a community outside of silos. And that really is so much of what we like to focus on. So you can find there that Sarah just sent posted the registration for our next event. So with that, I would like to thank everyone for your time today, and thank you, Andrew, Nannette, and Abigail. We are so appreciative of your contributions today, and we will be posting this information on our website shortly for folks who, if you want to send this on to others who aren't able to join. So have a good afternoon. Thank you.